Hi, this is Brian Lynch. Today we're talking about the Bonastent Esophageal stent and the proper technique for insertion into a patient. The Bonastent Esophageal stent comes in a sterilized pouch, and the first step is obviously to remove the stent catheter from the sterilized packaging. Simply grab the handle of the stent catheter and pull it out of the protective tubing. And once you have the catheter out, there is no preparation that needs to be done to the catheter. It is ready to be inserted into the patient. Before you're inserting the stent, you will need to have a guide wire in place across the lesion that you wish to stent. And if it's a very tight stricture, you may need to do some pre-dilation to accommodate the 18 French catheter that the Bonastent is loaded onto. So once you have your guide wire in position and your external fluoroscopic markers in place, you'll backload the Bonastent catheter onto the guide wire and insert it down into the patient's esophagus. Using fluoroscopy, there are 3 fluoroscopic markers on the Bonastent catheter. There's a proximal marker, a middle marker, and a distal marker. By far the most important fluoroscopic marker to concentrate on is the proximal marker of the Bonastent. The stent foreshortens up to the proximal marker, and it is the most accurate when placing the stent fluoroscopically. Once you have the stent in position and you're ready to deploy, the Bonastent is a coaxial deployment system, so you'll pin the back of the delivery catheter and then pull the outer sheath off of the stent to deploy. Some people also pin the catheter onto their chest just to make sure that it doesn't move forward. Once you have pinned the stent and you're ready to start deploying, you simply slowly pull the outer catheter back and the stent starts to deploy. We recommend going very slowly as you're deploying the Bonastent. That way you won't risk misplacement of the stent. One procedure tip to keep in mind, because it is a coaxial delivery system for the Bonastent, the stent will tend to move forward on the catheter as it's being deployed. If the operator notices that the stent has started to move distally during deployment, you simply need to pull the catheter back and get the proximal marker into position where you want the stent to land. Once you're happy with where the stent is deploying, you can then fully deploy it. But if you're not happy with how the stent is deploying, up to this red marker on the handle, which is 70%, approximately 70% deployed, you do have the ability to recapture the Bonastent esophageal stent and then reposition and start deployment again. But if you're happy with how the stent is deploying, you can then go past the red marker and fully deploy the stent. This is a 16 centimeter stent right here. And then you can resheath the catheter and remove it from the patient. Once the Bonastent has been deployed, if the operator decides that they want to reposition the stent post-deployment, the Bonastent comes with 2 retrieval lassos, one located on the proximal end of the stent and one located on the distal end of the stent. Whether the physician wants to move the stent proximally or distally, they'll use a retrieval forceps or a biopsy forceps, grab the retrieval lasso, and simply pull the stent in the direction they want it to go. You can see here that the stent elongates and gets thinner and can then slide up into or down to the position that the physician requires. If you have any questions, please feel free to contact us at customercare@therascent.com. Thanks and have a great day.